Okay. Good morning, everyone. My name is Julianne Bardaly. I'm your host today for Lurie Children's Facebook Live. Earlier this month, the Biden administration declared monkeypox a national health emergency. While very few pediatric cases have been reported, we thought it would be a good time to sit down with our experts and ask some questions as back to school season is upon us. Today, I'm joined by Dr. Larry Kosiolek, Medical Director of Infection Prevention and Control at Lurie Children's and an infectious diseases physician, and pediatrician, Dr. Jennifer Kusma. Thank you both for joining us. I want to make sure our viewers know that they can ask questions in real time in the comment section. We'll do our best to answer the questions during the broadcast, but if not, we can answer post the live broadcast. And to keep in mind that if you have questions regarding your child and specifics about their healthcare needs, it's best to reach out to your primary care provider for those questions. With that, let's get started. Thank you both for joining us. Dr. Kosiolek, let's just get down to the basics because before this was in the news, I didn't know much about it. What is monkeypox and what are the symptoms?
Yeah, that's a great question. Obviously we've become very sensitive to new infections, and there's many of them in the news, and monkeypox is one that's getting a lot of attention. And so monkeypox is a virus. The reason it's called monkeypox is many viruses can infect humans, but can also infect animals. And the disease was first noticed in monkeys several decades ago in the 1950s, but it wasn't known that it could infect humans until the 1970s. Since that time, cases have been sporadic and quite unusual and really limited to certain parts of the world. It's thought that even though monkeys are the first animals identified, we don't know if monkeys are actually the source. There's likely other mammals that can spread monkeypox. And so the cases that have been reported over the last several decades in humans have really been in relatively isolated parts of the world, particularly in areas where humans have a lot of direct contact with wild animals. When you hear the word pox, I mean, usually that's referring to some sort of skin infection like chicken pox, smallpox, et cetera. And so like those, even though they're not the same virus, monkeypox causes a skin infection that can be quite impressive and quite specific. And so it tends to be like smallpox, but much more mild. Usually when people are sick with monkeypox, they start with a fever, and shortly thereafter, they can get skin lesions. Sometimes they can have mouth sores or mouth lesions that start with that. Sometimes they can have swollen lymph nodes, particularly lymph nodes that are near the site of infection. And so they can be in the neck or the armpits or the groin. And those lymph nodes are usually swollen and tender. The rash will evolve over several days. It'll start as relatively flat lesions that can become small bumps. And then over the case of several days, they can be larger fluid-filled blisters that can look a little bit like chicken pox, but are usually much fewer in number and larger, but they have that sort of vesicle appearance of a bump that looks like it has fluid in it. Those will heal eventually, and once those lesions are completely healed and the skin is returned to normal, it's thought that people are no longer infectious or transmissible. That usually can take anywhere from 2 to 4 weeks from the start of the illness to occur.
And how is this spread?
That's a good question. So we seem to have a pretty good handle on how this is spread, particularly as we've monitored now over 10,000 cases in the US. We've been able to learn the most significant routes of infection. And it's pretty clear that the easiest way to transmit monkeypox is by having direct skin-to-skin contact with infected lesions. And so if you were to have skin-to-skin contact with somebody with active lesions and you were to touch those lesions directly, that's the easiest way to spread monkeypox. Now, in people that have monkeypox, they can get, for example, if their skin has direct contact with other things like towels or bed linens or clothing, it's possible that those items could spread to other people. And so if you share a bed with someone, for example, that has monkeypox, even though you may not have direct contact with the skin lesions, if you're far enough apart, having direct contact with those bed linens could potentially spread it. It's thought that it's possible to spread through the respiratory tract, but unlike things like COVID and flu and measles and chickenpox and other viruses that spread very easily through the respiratory tract, it's pretty hard to get monkeypox through the respiratory tract. And so if you were sitting face to face with someone with monkeypox for several hours, it's thought that at least 3 hours or more within about 3 to 6 feet of that person, while neither of you are wearing a mask, it is possible to spread through the respiratory route, but it's unlikely. It's thought that casual contact, like through doorknobs and door handles and railings on public transportation and things like that, it seems that those are pretty unlikely to spread monkeypox.
Okay, so you answered, I think, my next question, which is, we're so familiar with COVID and how transmissible that has become. So just to reiterate, how transmissible is monkeypox? Is it as transmissible as COVID? What I'm hearing is no, but.
Yeah, it's thought to be much more difficult to transmit with short, casual contact, brief contact than other respiratory viruses like COVID. For example, COVID usually require face-to-face contact for about 15 minutes to spread. Measles, for example, you don't even need face-to-face contact; it's airborne. If you can have somebody in your house who has measles and they can leave, and if you come into that house a half hour later, you could catch measles even though you didn't have direct contact with that person. Monkeypox is thought to not be easily spread through those casual or brief or indirect interactions. And so while that direct skin-to-skin contact is very, very easy to transmit monkeypox, that casual brief contact makes it unlikely. And for that reason, the health department is concerned about this disease, but they don't think it has the same pandemic potential as something like COVID or a new strain of flu virus, for example.
That's very reassuring. But I can imagine, Dr. Kuzma, as a pediatrician, you are getting some concern from parents with children, especially as back to school season is upon us. What would you share with parents on how they can protect their kids from getting monkeypox?
Yeah, thank you. And I think this goes along with what Dr. Kosielek was just saying. In this current outbreak, first off, there's been very few children who have been reported to have monkeypox. So less than 10 children, which as we heard, there's over 10,000 cases in the United States. So that's making up, less than 0.1% of the total cases. Outside of the United States, there's also been very few cases reported in children. So in general, we think children are at very low risk of developing monkeypox. And really, I've been recommending parents shouldn't be too concerned about their child getting monkeypox. I recommend parents are familiar with those signs and symptoms of monkeypox that we just heard about, and that parents seek care for themselves if they are concerned that they have monkeypox or they have been exposed to monkeypox. And parents being aware will then help prevent that transmission to their children. For the parents of adolescents, the American Academy of Pediatrics provides advice about how parents can discuss sex with their child at an age-appropriate level. Parents can also ask their pediatrician or engage with their pediatrician to have these conversations with their adolescents. Because we know monkeypox can be transmitted through close, intimate skin-to-skin contact, which could occur during sexual activity, sexual education is really important.
Great, thank you. And Dr. Kosielek, like I said, we know COVID so well by now. We've been living it for 2.5 years plus. Can we expect monkeypox to kind of take this same route that COVID did with variants, subvariants? What is there any knowledge or science behind what we can expect with this?
So that's a great question, and I think we're too early in this to know how this virus will evolve. The way viruses typically evolve and mutate is through random chance, and those rare random events are more likely to occur if infections are more numerous. And so, for example, in the United States, there are some days where we would see tens of thousands of infections in a single day, or even 100,000 infections in a single day or more sometimes. And then when you compare that worldwide, the number of infections that we're seeing on a daily basis were exponentially higher than monkeypox. And so with that number of infections with COVID, those rare mutation events are more likely to occur. With monkeypox, those infections seem to be less frequent, and it's less transmissible than COVID. And so these really rare mutation events are unlikely to lead to new variants or subvariants that require a complete reevaluation of the public health response or development of new vaccines, particularly in the time scale that we've seen with COVID. It's possible that that may happen over time, but I think it's unlikely. I just want to sort of reiterate something that Dr. Kuzma had said, in that currently that close skin-to-skin contact, the most significant risk factor that we've noticed in the United States is high-risk sexual activity. So sex with multiple partners, meeting partners through internet apps, and things like that. And so the American Academy of Pediatrics, as Dr. Kuzma mentioned, does have advice for parents of how to talk about those things with children. And it's also important for parents to understand that those high-risk sexual behaviors can also increase your risk for monkeypox, and there are things that you can do to protect yourself that I'm sure we'll talk about later in this talk. But since we have such a good handle of the risk factors, public health officials have been very active in counseling about those and increasing vaccine availability to groups with those high-risk behaviors. And so we're very well equipped to get this under control than we would with something like COVID can be spread so easily through brief casual interactions.
Again, that's another reassuring point, since we know COVID so well and how it's taken on different forms over the last 2.5 years. So that's good points. Jenny, or Dr. Kuzma, sorry. What should I do if I suspect my child has monkeypox?
So if you suspect your child has monkeypox, the most important thing to remember is, number one, monkeypox tends to be a pretty mild illness in most cases. So I hope that provides some reassurance. If your child does have it, the child should remain at home until all of those lesions have healed. So as Dr. Kosiolek talked about, that's that skin being back to entirely healed. It's progressed through all of the different sort of phases of those bumps that we see. Once that skin is back to its normal state, we would imagine that that child is no longer contagious, which can take 2 to 4 weeks. So the other things families can do are keep all skin lesions covered. Wearing a mask if you're in the same home can prevent transmission within the same household. I think as we talked about, bed linens can be a way that this infection can be shared. So I think if it's a situation where multiple children share the same bed, like sleep surface, if you can try and separate people as much as possible, washing towels frequently, things like that generally help us prevent that quick spread of infection.
Great. And I think that was my next question, is if a parent is suspecting that they may have been exposed or they have monkeypox. So same precautions, same measures to take.
And if someone has been exposed to monkeypox, the recommendation is that they get the monkeypox vaccine per the CDC. And I think later on, we're going to talk a little bit more about the vaccine, but that an exposure is considered a reason to get that monkeypox vaccine. So if once the first person in the household is considered exposed, I would recommend that they get it.
Okay. Actually, this was a new question that popped in my head. Is there, if a parent does suspect that there's an exposure, with COVID, we've tested and without symptoms, with symptoms, we've tested for a lot of these last 2.5 years. Is there a test that's done for monkeypox?
So we do have a test for monkeypox, but it can only be performed once you have symptoms. And so and the way to easily diagnose monkeypox is from swabbing the skin lesion. So in COVID, for example, we know that most of the virus is in the upper airway, and so we swab the upper airway. We know that somebody can have and transmit COVID before they have symptoms, which is why we oftentimes will test prior to the onset of symptoms. Monkeypox is different. It's impossible to transmit monkeypox until you have symptoms. Another reason monkeypox is different is that there's not a whole lot of virus in the respiratory tract, and which is why it doesn't transmit very easily through that casual face-to-face interaction. And so once you have skin lesions, the virus is really concentrated in those skin lesions, and you can swab those. I think one really important, a lot of important things have come out of the COVID-19 pandemic from a public health standpoint, but one really important aspect is that it's increased testing capacity through the health department and really increased the collaboration between commercial laboratories and health department laboratories. And so with COVID, it took several months to really increase capacity for commercial laboratories to be providing testing for COVID. With monkeypox, not only are health departments able to do testing with higher throughput and faster turnaround time, but there's also many private labs like Quest and LabCorp that have very, very quickly increased their capacity for monkeypox. And that's what's contributed to the spiking cases that we've seen over the last several weeks since we're diagnosing them more. But it's also improved the ability for public health departments then to contact trace and to identify those exposed so they can educate them about the signs and symptoms, to isolate if they develop those, and to seek care from their healthcare provider if they develop those symptoms.
Dr. Kosiolek, we've mentioned this earlier in the broadcast, but for those who have joined us, how serious should parents and caregivers, teachers be taking this new infectious disease?
Yeah, I think that's a really great question, and I think that's always something that's I think difficult to message to families, right? I mean, we're bombarded with information, and the information that we get on infectious diseases it comes fast to our phones with alerts from our news sites and our social media feeds, and sometimes misinformation comes through social media as well, and so it can be difficult for parents to really gauge their risk. I think as a parent, the way I would look at monkeypox is that I should be aware that this exists. I should educate and familiarize myself with the risk factors and the signs and symptoms for both myself and my child, and relying on reputable sources like the Centers for Disease Control and Prevention, the CDC. Our Children's Hospital provides stuff on our website, as many other hospitals do, and our local health departments for good, reliable information. But I don't think monkeypox, for those that don't have risk factors for disease, and right now that highest risk factor disease is that high risk sexual activity. That's the primary risk factor. And so for individuals with those risk factors, which can include both adults and adolescents, counseling on risk avoidance really is essential. However, if you come from a household or a family without those risk factors, it doesn't really require a major change in our daily lives. We should not be fearful about school and other things that are very, very important, and we should be very comfortable doing the things that we consider to be essential for our children's education, growth, and development.
And that was actually my next question, Dr. Kusma. Parents rightly probably have some concerns. They don't know much about monkeypox. We have school starting soon. Can I safely send my kid back to school? Should I be worried about that? What about public pools, playgrounds, normal kid activities that we've actually had on hold for much of the last 2 years? How safely can they resume those activities?
Yeah, I think going off what Dr. Kosiolek just said, this is something that I have been counseling parents that, I'm excited for kids to be getting back to school. I think a lot of children, like for over the last two and a half years, had had therapies put on hold, in-person school put on hold, and with the monkeypox, the ways we know that it's transmitted, I feel very comfortable saying, yes, send your children to school, let them go swimming if that's what they want to do. Please keep them in their therapies that are helping them with development, all of these things that we know children need. I think that risk of transmission of monkeypox in those ways is very low. Now, if you are educated on the symptoms of monkeypox, you notice your child might be developing symptoms of monkeypox, then definitely keep them home. But outside of that, I definitely recommend still doing all those things.
And that would be inclusive, right, of traveling. Because I know with COVID, there were hot spots and, certain measures that you had to take when returning from a place that had an elevated number of cases. Would that still, pertain to travel at this point with monkeypox?
Yeah, I think as long as you're following, all of the monitoring symptoms, knowing, risks, knowing if, the people you're going to travel, making, being aware of your surroundings. But I think in general, going and traveling and doing everything is totally safe to do.
It's good to know. Let's get more into how monkeypox is treated. Dr. Kosiolek?
Yes, and so we're learning more about treatment as we gain more experience with this, and many times our federal government in the World Health Organization, for example, will work to identify treatments that show some promise, either in animal models or through limited experience about treating outbreaks in isolated parts of the world. But when these infections are rare, it's difficult to develop really large clinical trials around treatment. It's just the reality of emerging infectious diseases. But the U.S. government, many public health departments around the world have stockpiled certain treatments that are available in the case of a public health emergency. And one of the important steps that state governors have made in high impact states and President Biden has made is by declaring this a public health emergency, because that does is reduces barriers to production and distribution of those medicines and vaccines, which I think we'll also talk about soon, and increasing funding to have those available to the general public. And so that process is already on the way. The best way to treat viruses is typically through two ways. One is what we call antiviral medicines. And what that does is it attacks the virus specifically and prevents it from being able to replicate. And so it shuts down that virus in the body. And there's one antiviral medicine called TPOXX that we don't have a ton of experience with, but we're learning more and more about it as we use it during this current outbreak. And so right now that medicine is being offered to both children and adults. There's both an IV form and a pill form. And most people won't need it, but those who have a more severe disease or have symptoms that are more worrisome are eligible for that medicine with some additional oversight from the FDA to be sure that we're gathering data in real time about how safe and effective it is. And so far, those data have been very, very promising. There's other antiviral medicines that we have available as well as sort of backups that we have a little bit more experience with in both adults and children. The other way we can treat viruses is by modifying the immune system's ability to fight the virus. And so there are antibodies that have been developed against this virus that we can give to both adults and children to help them fight this virus as well. Again, most people won't require treatment, but we certainly have availability of treatment to be able to get it rapidly through the federal government in those that require it.
And then, of course, with those symptoms like fever, the actual blisters, are they itchy? We would approach it as a way that we normally do with fever reducing medications, right? Can you put cold compresses on the blisters? What would be the recommendation there?
Yeah, and so managing the symptoms will be really important. These symptoms, the lesions themselves can be painful. And so those that have a lot of mouth sores may not be able to eat or drink. And so they may require IV fluids in the hospital, for example, or things like if you've had a child with hand, foot, mouth disease, for example, which is a completely different virus and actually quite common this time of year, your pediatrician may have prescribed a magic mouthwash that has some different components to make the mouth sores more tolerable so that you can drink and eat. And so those types of things would be done for mouth sores or mouth pain. Other fever reducing medicines would be used if you have fever. Fever is typically a very short period of time early on in the illness before the rash starts. The skin lesions can be painful. I'm hearing that they tend to be more painful than itchy, but maybe itchy particularly later in the illness. But controlling the pain from those lesions with various modalities will be important to keep people comfortable who have it. If you have eczema and get or an immune compromising condition, and you do happen to get monkeypox, then you may have more lesions than would someone without those conditions. And so we would be particularly interested in making sure those individuals are monitored closely and get treatment. You will read that children younger than 8 are at higher risk of severe disease. I just want to point that out because that's listed on the CDC site. There's a lot of reputable sites that are reporting that. While that is true, those data are really for a different variant of monkeypox that's seen in certain parts of the world. What we're seeing in the United States and spreading through Europe and other parts of the world are not that specific variant. But out of an abundance of caution, we are particularly interested in making sure children younger than 8, if they do have monkeypox, are monitored closely and potentially given treatment.
And then let's talk about the vaccine. I was surprised to learn that there is a vaccine already in existence. Who's eligible for that? Is it a dose series? A little bit more information about that.
Yes, and so there's a vaccine called Jynneos, which is it's considered a live virus vaccine, but what makes it safer than other live virus vaccines is that it doesn't replicate inside your body, so the side effects tend to be less. But it seems to be quite effective. And so right now there's, because this vaccine is for infections that are very, very rare, we don't have, we're not sitting on millions of doses of monkeypox vaccine like we would be for flu vaccine or COVID vaccines or anything like that. And so when that happens, what health departments do is identify a strategy for vaccinating those at higher risk for developing monkeypox, both to keep them from getting the symptoms of monkeypox and also to keep them from spreading to other people. And so that vaccine is thought to be a 2-dose series given 4 weeks apart. It was given an emergency use authorization by the Food and Drug Administration, which has reduced barriers of getting vaccine for those people who are at risk. And those are typically given through health departments and who provide it to hospitals and other health centers to administer it. Right now, those who are eligible for vaccine are those that we consider to be at highest risk. So if you have a known exposure to monkeypox, so you're a parent that developed monkeypox and you didn't recognize the symptoms right away, and you have a child in the home who had direct contact with you while you had those skin lesions, your child would be considered exposed. The best public health strategy would be for those exposed individuals to get the vaccine within 4 days of being exposed. If we did in the first 4 days after exposure, that's the best chance of completely preventing monkeypox. If given after 4 days, then it's likely that we'll reduce the severity of disease, but we may not prevent it. One of the public health benefits of monkeypox is that it's a really long incubation period. Unlike COVID, where you could develop symptoms, even a few days after exposure, monkeypox, if you're exposed today, you won't develop symptoms until a week or 2 later. And so that gives us more time to intervene after the exposure, and public health infrastructure has expanded the contact tracing efforts. There's other individuals, even if you haven't been exposed, that have really high likelihood of being exposed to monkeypox in an ongoing fashion. And right now, what we're seeing is that those with high risk sexual activity tend to be at the highest risk. And in particular, among adults who have high risk sexual activity, the risk is even higher among gay and transgender individuals who are engaging in high risk sexual behavior. And so those individuals currently are eligible for vaccine as well. As we increase the amount of vaccine that's available in the United States and to public health departments and hospitals, it's likely that the eligibility will expand over time, but it'll likely be some time before it would be available to the general public.
Great information. Those were all the questions I had, and I think we were left with a lot of good information here, and I know I feel reassured now as a parent myself. So I thank you both. Anything else to add? Okay, well, thank you. We will put some links to our FAQ that is live on our website for reference for our viewers. But thank you both, Dr. Kusma and Kosiolek, for joining us this morning.
Great. Thanks so much.
Thanks.